The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, November 13th, 2018. Wow, we're ripping through November here. We're going to be talking a lot about physician wellness this evening with a rheumatologist. We haven't had a rheumatologist on the program in a good while, so I'm really excited for this talk. It's Dr. Sean Baca. He's with Rheumatology Associates of South Florida. They're in Boca Raton and Delray Beach, I believe, and he's going to tell us a little bit more about it. But Dr. Baca, without further ado, welcome to the program.
Oh, thank you. Thank you for having me. Last year I was president of the County Medical Association, and one thing that is becoming a very big national movement is physician wellness. And the issues are that physicians in general are very unhappy with the current system. Patients have felt for a long time they've been traumatized by the medical system, and I think now the physicians are also starting to feel traumatized by the system. And one of the dirty secrets about medicine is that physician suicide in this country is on the uptake. And we have over 400 physicians that kill themselves every year in this country. What most physicians will tell you is if you ask a physician if they've known somebody who actually killed themselves, almost everybody will raise their hand in the room. I know personally of 3 friends who did. And what's driving this is basically a lot of changes are happening very fast without really consulting the people that drive the bus, i.e. the physicians or the patients. So, so one of the terms that was coined was something called moral injury. And you got to remember that most physicians are your goody two-shoe kids that got straight A's in school, and you know they're kids who generally tried very hard, and they're willing to really sacrifice their 20s and even part of their 30s in order to be physicians, because you pretty much have to study full-time. And so you have this win-win type person who basically comes out in the real world and realizes that things aren't what they expected. And the concept of moral injury basically is what's happening now is insurance companies are kind of pitting you against the patient. And an example would be is let's say your patient needs some special medication or something else, and you've got a life like everybody else, and you've got your kids, and you got to go to their sports events or something else in the evening. But what happens is that you see 3 patients, you're running behind, and essentially they need these special medicines. And it's going to cost you about 30 minutes per patient that you're not getting compensated for to fill out the forms, you know, yell at the people on the other end why they need the special medication. And then eventually you'll get everything done. But if you do that, then guess what? You miss your kids' stuff, you know. So then you go home and then your wife is crabby at you, or you don't do that and your wife is happy with it. But then you feel bad about the job that you're doing, because they put you kind of in an impossible situation, and then that creates what sometimes is self-loathing. And self-loathing, you know, contributes to, you know, people feeling like I didn't sign up for this. You know, I want to be a good guy, but, you know, I'm kind of being put in a position where sometimes it's more expedient to be a bad guy, or maybe I'm going to get more of a bonus if I, you know, restrict people's health care and don't give them what they need, because it might actually, you know, be beneficial to me. So this is creating a lot of unhappiness. The situation is that we have to find solutions to this. And part of it is that, the CEOs of most of the healthcare companies will say, doctors just need to be more resilient, eat yoga, do yoga and eat granola, but that's not going to solve these problems. And that's kind of been the corporate attitude on how to solve this. And a big problem is driving this is a lack of autonomy. Like I'm a lucky fella because, I work in a group and I work with really wonderful people, but we own our practice. So we can decide if we want to see patients, when we want to see patients. We run a free clinic once a month. So we can give back to the community. But those are all choices. If you work for an institution, they're not going to allow you to see patients for free.
No, that's not going to happen.
And at the same time, you may have favorite patients that you've been seeing for 20, 30 years. They're down on the luck. You know what? I'll see you. It's not a problem. Either we give you reduced fees or even no fees sometimes, but we get you through the system. And private practice really fills all the cracks in the holes in medicine. And what's going to happen is that if you have that special blue, gold, platinum card in your health insurance and you lose it tomorrow, you could have a history with an institution down the road that has a very good reputation, but the minute you lose that card, you're gone, And so, the lack of all of these support systems are actually very bad for the patients. So that's why the patients need to care about what's going on, because the physicians are unhappy. This is also going to contribute to their, not well-being. An example is that they said that 50% of physicians over 50 would quit the system within a year if they had the opportunity to. But those are pretty bad numbers. Majority of physicians tell their children not to go to medical school. That's a problem, okay? Because this is a very honored profession, but the problem is it becoming a job. And a profession is not the same thing as a job. We do things because we love to do them. We do things because we love our patients, and we want to do the right thing. But when it becomes a business, then it starts getting treated like a business, which means you're a commodity. It's just about getting them in and out. It's about, doing whatever, basically improves things. And so there are a lot of, situations that really are making things very untenable. So we have started a countywide, basically a mental health line or a health line for physicians. So if you call the County Medical Association, and you have issues with, personal distress as a physician. Now, this is not for non-physicians. We've actually I've donated a fair amount of money to this cause, and we're actually have a totally anonymous situation. We don't know who it is, but we'll get a bill from the psychologist. We have several psychologists who have agreed to see physicians, and we give them 5 free treatments, and then basically try to get them hopefully off the edge. To help with some of the other things, we've developed a library of resources, and we're now starting the next phase of more networking among physicians so that, they can, discuss some of those issues. And, part of also, helping us feel better about the system is participating. We're trying to get the younger doctors involved in the politics and all the other things in medicine, because if you don't get involved in politics and medicine now, pretty much somebody's going to dictate to you what you're going to be doing in the future.
Yeah, definitely. And is that help with the, because I know you're past president of the Palm Beach County Medical Association, right. So is that help through that
yeah, it's through chapter? That organization. And this, as I said, is becoming a national, movement. The Florida Medical Association now has, also some wellness capabilities. The AMA has been pushing this as well. But this is really a local problem, and you need, local solutions to it, which means, you'd have to have a local hotline. You also have to have, local mixers and some other things. And, if we can bring these parties together, then hopefully this will help. But, the biggest challenge right now is that, medicine is becoming basically, overtaken by business interests. And, there can always be benevolent or malevolent business interests, and it depends on the institution and other things, but some are doing a better job and some, frankly, are not doing good jobs. We've heard of a lot of turnover at some of the local hospitals. There was one local hospital that literally had 40 physicians or employees all quit in 1 month just because they were, mandering with, certain kinds of things that were just untenable for these physicians to work. And, somebody who works that hard and goes to medicine and does all these things to do the right thing, the last thing they need to do is, be put out on their ear. And, So I'm a big advocate for people staying in private practice, because the only person that can fire me is me. But the problem is, you could work for an institution, they could say, you know what, we love your work, but we've decided we need a bigger whatever department, so we've decided to eliminate your department. So you're at the whims of somebody else, and essentially you have no equity. And a lot of times they make physicians sign these things called restricted covenants, which means that if you don't do what they tell you and they fire you, you have to leave town.
And that's starting over.
Completely.
Yeah,
And you may have roots,
tough.
and so you just kind of stick it out and, do your best. And, and the problem is that there's plenty of statistics to show that if a physician leaves, it costs the institution at least $250,000 in lost revenue and recruitment, and to get another physician to join. You also have issues with increased malpractice, because there is lots of evidence that malpractice claims go up with unhappy physicians. So a happy workforce is probably a good thing, and it trickles down to everything, including the patients, the nurses, and everything else, because everybody's feeling that they're working harder on this treadmill to get less and less, or at least to stay in the same position. And again, that's not a tenable position after a while. One of the things that's driving some of the physician wellness issues is the computer. EMR, it sounds like a great idea in theory, but the problem is that the government got involved, and so they're asking for all this crazy nonsense, such as, you have to put what kind of Hispanic you are on the form, and you have to have this, and you have to all these quality measures. And most of us feel a lot of these quality measures are really not appropriate, and you're filling out forms all day long in order for you to get paid. And that takes away from the visit, which the main person in the room should be. You should be looking at your patient rather than looking at the computer screen all day long.
Sounds like clicking boxes instead of giving care there.
Right.
We're here with Dr. Sean Baca. He's I got your last name right. I should have asked you that before you came on, right?
You're perfect.
Baca?
Yeah.
Okay, good.
Yeah.
I'm glad. Well, he's with Dr. Baca's with Rheumatology Associates of South Florida, and we're going to give out their info in a minute. Dr. Baca, thank you for bringing up some great subject matter that we really don't get to on this show. So kudos to that first. I have a couple thoughts. I actually know of two physicians that I know of their names in the area who unfortunately committed suicide. So this is a very big deal. I wanted to ask you, primary care. Everyone says primary care is so needed, and it's a void that needs to be filled. But if these quality of life issues aren't taken care of, there's not going to be any people signing up to do primary care, right? To go through the residency and training, etc., medical school.
That is a major problem, and I have nothing but great respect for primary care. Rheumatology is very close to primary care because we spend most of our time with the patients, don't have a lot of flashy procedures and stuff that we can do to basically countermand the low rates. But the issue is basically this. We're spending a lot of money to produce a medical student. So even though they're paying a lot of money in tuition, believe me, that medical school is expensive, and you've got that morgue downstairs, and you've got that building, and all those people work in that building. So the state puts a lot of money into a person's education. But the facts are not good. For physicians, female physicians, the numbers are as high as up to 50% of female physicians are no longer practicing medicine 10 years after they finish medical school. And of the 50% that are working, because of home issues and family care, which is still not very even, still women do the brunt of care at home, and the husbands probably could do a little bit more. 50% of physicians who are working do part-time schedules. So that contributes to that, because again, the system is such that you just really can't work, and be a good parent sometimes. At least it's hard for people to juggle. The other issue is loans, and this is one of the other things that's driving unhappiness. Is the average physician now has about $300,000 in debt, some even more, depending if they go into private school or not, and that's a mortgage on your back. So that determines where you're going to work, and that determines whether or not you can take the quick hit and be the employee, rather than venturing out on your own and having your own adventure and your own practice, and all those things that basically are probably a little more fulfilling in the long run. And the other thing is that, remember I said a lot of physicians want to quit. So when you think about it, what is easier to do? Educate a bunch of physicians with the hope that maybe 10% of them, 15% of them end up in primary care, or just treat the guys that are in their 50s a little bit better, And that does not necessarily mean more money. Maybe just, hassle less with fewer forms, not playing gotcha with all this billing stuff, and then have them stay in practice another 10 years, or have to graduate somebody from scratch. Then you got to train them. Then you got to hope that a certain proportion of them, basically end up staying in the area, which right now, I understand the statistics in the residency programs in Palm Beach County are not very favorable, is that a lot of physicians are leaving Florida. The most doctor-friendly state in the union right now is Texas, because they have malpractice controls and everything else. And we just had a malpractice situation where our malpractice caps just got overturned by this Supreme Court that we have, which just got their extra 5 years added to the tenure, which was all about that Marcy's bill. Is the second part of it was that we're going to extend the judge another 5 years. So those judges actually overturned our malpractice. So now physicians again are at, basically seeing patients with a gun to their head every time they see them, and you could lose everything that you have, when you see a patient.
Yeah, that's rough. It's a rough times right now. Dr. Baca, hold that thought. We're going to take a quick break, and on the other side, talk a little bit about, this is a term I really wanted to ask you about, vertical integration, and why are drugs so expensive on the You and Your Doctor show?
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and welcome back. We're here with Dr. Sean Baca from Rheumatology Associates of South Florida. They're in Boca Raton at 1050 Northwest 15th Street and in Delray Beach at 5162 Linton Boulevard. That's on the campus of Delray Medical Center. You can reach Dr. Baca's office here in Boca at 561-368-5611, and I will give out that info again. Great website, rasf.com. That's Rheumatology Associates of South Florida. So we talked a lot about physician wellness and a little bit about healthcare reform. I wanted to use this last 15 minutes to talk a little bit about first vertical integration, and then I'll ask you why drugs are so expensive. But what is vertical integration?
Okay, so as we know that we're all now fully invested in Obamacare, and whether we don't want to make this political, but basically the bottom line is that that was the thought is that they wanted to vertically integrate healthcare, meaning that the physicians and the doctors and the hospitals and everybody kind of, are under one roof. And vertical integration is kind of a euphemism for monopoly. So monopolies are never good for the consumer. Okay. We live in a country right now where guys want to wear a dress and go to the women's bathroom, but you want to have a one-size-fits-all healthcare system. It's not going to work. It's just not going to work. And, everybody, confuses themselves with, this, single payer, et cetera, et cetera. And if we have time, we'll talk about that. But these things just aren't going to work. And the problem is we live in a pluralistic country where people want to have needs met in a different way, and you basically are trying to pull the old school, we're going to have it one way, and that's just the way it is, and it's just not going to work. So, there are ways of fixing healthcare, but the problem is that, as they say, it's the cost dummy. I mean, it's nothing more than that. Things are too expensive. I have drugs that I order, and they're literally $5,000 a month. For treating rheumatoid arthritis. These are revolutionary drugs. We don't have as many crippled people as we used to, that have these terrible diseases. But these are basically the price of a mortgage or more. And people can't afford these things. And this has to change. But the problem is having vertical integration is probably the worst possible idea, because how is a monopoly ever going to help patients? The only thing that's ever lowered prices in the history of mankind is called healthy competition. But the problem is you don't have healthy competition right now. Okay, and it goes all the way from the top to the bottom. And the problem is that until this present, we've had absolutely no one talking about drug prices. And there's a lot of dirty secrets right now in terms of drugs. So the supply chain is basically costing about 50% of the cost of the drug. So, for example, you have these things called PBMs. There's Express Scripts, CVS Caremark, et cetera. And if you look at the Fortune 500, in the top 30, 6 of them are PBMs, when you think about it. So I'll give you an example. One of the PBMs made over $100 billion last year. Now, Johnson & Johnson, which is the world's largest drug company, made about $70 billion with 500,000 employees. And this PBM with maybe 20,000 employees almost made double the income. So what is a PBM? They're a pharmacy benefit manager. So they're hired by the insurance company to manage your benefits. So if you ever go to the doctor and you say there's a tier 1 drug and a tier 2 and a tier 3, well, that's all based on trying to encourage the patient to take the less expensive medications. But what has been perverted so that the patient may get the more expensive medicine is preferred because the drug company is forced to pay them rebates and also administrative fees. So for the biologics, the drugs that I order, the rebates and administrative fees can be up to 50% of the cost of the drug. So when you think about it, these companies are Enron. They produce no drug. They don't even warehouse the stuff. They don't do anything except virtually say you may have the drug, but only because we worked out this deal with the insurance company. And by the way, we're taking a big piece of the money ourselves, because if you don't pay us, then we're not going to let your drug go on the formulary at all. And if you have multiple products for your company, then they can really hurt you very badly. And what you're doing is, when you have your vertical integration, essentially you're going to have 3 or 4 insurance companies that control the entire market across the country. And then they can say, you know what? None of your drugs from company X are going to be on the formulary, but we'll have company Y. But guess what? Company Y is paying us a little bit more money. Now, anywhere else, that's called a bribe, and that should be totally illegal. So when you get your drug statement, the first thing that you notice is that they say how much money they saved you. Mm-hmm. They don't actually tell you how much money they spent. So this is how it works. Let's say the drug is a biologic, is $5,000. Well, they've extracted with administrative fees, rebates, blah, 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 about 45% of the actual drug doesn't go to the drug company. It goes to the insurance company and the PBMs, okay? But they hide it, because when they show you the statement, they show you only the retail cost. You pay a copay of, say, 20% of the drug. Well, your copay is really 40% of the drug, because guess what? It's off the retail price, but the real price is this price. So then you're paying about this much of it. And then what happens typically is the drug companies know that most patients can't pay $500 a month for a drug, so they'll come in and pay that $500 for you in a rebate or coupon card. So essentially, the drug company is getting about 50%, sometimes as low as 40% of the actual drug cost. So you talk about waste, basically 40 to 50% of your money is going to some other outside entity that's not even doing anything to help you. And new drugs are very expensive because they're made, actually they're called biologics, and they're actually made genetically. They actually make these things in Chinese hamster ovaries. And so it takes 8 to 9 months to make these drugs from the time they start. So these are not going to be inexpensive things to make until technology gets better, but they are life-saving drugs, and they're coming out now for all kinds of things, including cancers now, and these are the game changers. But how do we afford it? And one way to do it is get basically the pigs out of the system. And so nothing like that is really happening. You don't see much motion on it. There was one bill that was going in front of the nation, and basically what happened is that they used the word rebate. So very quietly, they've been scaling back the rebates to 5% and 6%, but they've been increasing the administrative fees to 40%. So now they're claiming, well, rebates are only 5%, and we give the rebates most of it back to the insurance company, but they forget about the other stuff. So it's a big problem. But what we need is transparency. What we need as national law is to say, very simply, I would like to see how much money the insurance company actually paid towards my drug, rather than, and how much did I pay towards a drug? Because you'll be shocked that the fact is that these drug prices are not real. And of course, they give sticker price, but at the same time, we have to do something about this, because you're never going to actually figure out how to solve this problem until you know what pricing is. And part of the issue too is the FDA, because they create monopolies with drugs. I'll give you an example. This colchicine is a drug that's been around since the time of Hippocrates. And it used to come from the bark of a tree, used it for the gout, worked pretty well. And some years ago, some wiseacre went to the FDA and said, well, we know it works for this rare condition, but you've never done a real study. So therefore, if we do the real study, will you give us an exclusive? And they did, and they spent the money, and basically they pushed all the generics off the market.
And you got another minute. I was just going to tell you, wow, this is fascinating. I think everyone should go home, watch this show again, and digest all this, because this is very thought-provoking for our future in this country.
It's a major problem, and we need to do something to fix this. And but we're not going to fix this by, saying we're going to ration health care, or we're going to force you all into an HMO or this or that. That's not the problem. The problem is physicians should have the tools to treat you properly, and they should be inexpensive. It shouldn't be this begging to get stuff and not having supplies that we need.
Well, Dr. Baca, thank you. It's Dr. Sean Baca, Rheumatology Associates of South Florida, RASF.com. I'd love to have you back on the program in the future to continue this conversation.
Yeah.
Thank you, South Florida.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.